Hi, I want to talk about intercostal neuritis. Intercostal neuritis means that the thoracic spine, the 12 vertebrae in the back, you have ribs that attach to those vertebrae and wrap around all the way to the front of the chest. Some of them attach into the sternal area, and some are free-floating ribs. But the bottom line is that in between these ribs, these intercostal muscles, you must have nerves that supply these muscles, and they're called intercostal nerves. And these intercostal nerves come from the thoracic vertebrae and wrap all the way around. So the tricky part about this particular condition is that you can have pain in your mid-back or have pain wrapping around the ribs all the way around to the front of the chest. Quite commonly, we'll see many people who have difficulty taking a deep breath. It kind of catches them with pain. That is a classic form of intercostal neuritis. Many times people will think it's their heart or any another kind of organ that's giving them issues, and they can become very worried about it. But with this condition, this is quite commonly seen with people with poor posture, people that hunch over a lot, at a desk, forward head, anterior translation, rounding of the shoulders, or people that just seem to stand up with poor posture. Even people with big abdomens that have weak core. When you have a weak core, it's going to make you slump, even though you may not feel like you're all slumped over. But the areas between the mid-back are taking a lot of toll. The muscles are contracting. The nerves can become very irritated and inflamed. So what do you do with this situation? Well, most important, you have to make sure you have the proper diagnosis. Using moist heat has been very effective. A moist heating pad, 15-20 minutes at a time, can release the muscles. You still need to focus on building your core. A good little stretch is when you just hang. You hang out from above you and just hang and let those erector muscles stretch out. Sitting in a chair and just leaning over, touching your toes, just stretching those muscles are extremely beneficial and effective for you. But most important, you need to break the habit of the poor posture. That rounded shoulder, that forward head translation, bringing the head forward. Remember, your head weighs 12 pounds. For every inch you go forward, it's an additional 10 pounds. 1 inch, 22 pounds. 2 inches, 32 pounds. 3 inches forward is 42 pounds of stress. Pulling on the upper trapezius muscles, pulling on the levator scapular muscles, and causing this hunching, rounding effect. Even dowager's hump. Between the cervical and thoracic region, the lower part of the neck, we start getting this inflammation present as a result of this pulling of these ligaments as the body starts reinforcing that weakness and putting lots of inflammation in the area. So this intercostal neuritis, most important, watch your posture. A very good thing you could also do is strengthen the rhomboid muscles, stretch the pec muscles or the chest muscles, go between the door and just kind of lean in. That will really help you as well. But intercostal neuritis, you got to let it reduce the inflammation, but you need to reduce the causation of what's causing that particular problem. If you have any questions, you can feel free to write them in below, or any comments, go ahead and share them. With these particular conditions, a massage therapist, a neuromuscular therapist, or even a chiropractor could be helpful for this. In many cases, by the way, the vertebrae, the thoracic vertebrae, can go forward or anterior. Okay, and as it goes anterior, the articulation to where the ribs meet the vertebrae are a little off, causing the nerve to inflame as well. So if all these things you do at home are not helping you, get to a good chiropractor and mention anteriors. Anteriors, when the vertebrae go forward, and many times that can correct the problem in its own. Make it a great day. I'm Dr. Alan Mandell.